Hello and welcome to my YouTube channel. Today I will be talking about gangrene. What is gangrene? Gangrene is death of body tissue due to lack of blood supply or bacterial infection. It commonly affects the limb, including the toes and finger. It can also occur in muscles and organs inside the body. What are the causes of gangrene? It could be because of lack of blood supply, bacterial infection, or traumatic injury. Coming to the types of gangrene, there are three types of gangrene: dry gangrene, wet gangrene, and gas gangrene. Dry gangrene. Dry gangrene is a form of coagulative necrosis that develops in ischemic tissue where the blood supply is inadequate to keep tissue viable. Here, there is limited oxygen in the ischemic limb, so it limits putrefaction. So, because of the limited oxygen, the bacteria will not be able to survive, and there are only few bacteria which could survive. So, there is a limited putrefaction in dry gangrene. How will the affected part look? The affected part will be dry, shrunken, and black. And why black? This black color is formed due to formation of iron sulfide. The H2S gas from the bacteria combines with the iron of the heme liberated by the hemolyzed RBCs in that area. So, there is formation of iron sulfide which will give the blackish appearance. Very important point here is that the line of demarcation is present between the dead and the viable tissue. I will show you an image. As you can see here, this is from a patient having dry gangrene of the foot. And as you can see, the blackish discoloration involving the great toe and the adjacent two toes, this is the gangrenous tissue which is actually dry gangrene. You can note it is blackish, appears dry. And you can also see there is a line of demarcation which I have depicted with the arrow, which separates the gangrenous tissue from the healthy tissue. So always remember, in dry gangrene there is presence of a line of demarcation. You can see gangrenous tissue is totally separated from the healthy tissue by this line of demarcation. Coming to wet gangrene. Wet gangrene usually develops rapidly due to blockage of venous or arterial blood flow. Always remember here, generally the blockage is in the venous drainage. So what will happen if the venous drainage is blocked? The affected part will be filled with stagnant blood which will promote the rapid growth of bacteria. And when there is rapid growth of bacteria, what will happen? On the coagulative necrosis, there will be superadded liquefactive necrosis which gives rise to a moist, edematous, putrid, dark appearance. So always remember, in wet gangrene, the affected part will be moist due to liquefaction, edematous, putrid, and dark. And there will be no line of demarcation. The line of demarcation is seen in dry gangrene, not in the wet gangrene. And you can see here the appearance of wet gangrene affecting the bowels. The bowel loops look swollen, moist, and discolored. Here there is a cut surface of the intestinal wall where you can appreciate the darkish discoloration of the intestinal wall. So this is how a wet gangrene will look. In patients who have diabetes, when they injure their toe or foot, there could be development of wet gangrene. Always remember, as I have told you, that dry gangrene generally affects the limbs. But in diabetes, the gangrene which is developing on injury to the foot or the toe is wet gangrene. And why in diabetes wet gangrene develops? It is because you all know that in diabetes, the patient has hyperglycemia. The glucose level is more. So, because there is lot of glucose available, there will be proliferation of the bacteria. And whenever there is proliferation of the bacteria, it will lead to liquefaction. So, the type of gangrene is wet gangrene in diabetes. Coming to a special type of gangrene which is known as Fournier's gangrene. This type of gangrene involves the genital organs. As you can see here in the image, the scrotum is showing Fournier's gangrene. Coming to the next slide, Gas gangrene. Well, gas gangrene is a bacterial infection that produces gas within the tissues. The main causative agent here is Clostridium perfringens bacteria, which is an anaerobic gram-positive bacteria. This bacteria produces certain toxins leading to myonecrosis and production of gas, which spreads through the tissue planes and form blisters. The gas is mainly composed of nitrogen, oxygen, hydrogen sulfide, and carbon dioxide. And in gas gangrene, there is a rapid progression to shock. In gas gangrene, the skin becomes paler and also turns gray or purplish red. The skin may look bubbly and there will be a crackling sound when you press on it because of the gas within the tissue. Like wet gangrene, gas gangrene is also a life-threatening condition. It can lead to serious complications if not immediately treated because bacteria can spread quickly to other tissues and organs. So, the surgical intervention here is mostly required immediately to save the patient's life. Here in this picture, I have shown you the morphology of Clostridium perfringens bacteria, which is the main causative agent of gas gangrene. Also in this picture, you can notice a person's lower limb is affected by gas gangrene and there are formation of these blackish blisters. These are gas-filled blisters. When we palpate these blisters, we can feel a crepitant sound, and this crepitant sound is because of gas. Because of the gas in this blisters, there will be always a crepitant sound, which is a crackling sound. Coming to the end of the session, let me revise this for you. So here I have made a table which is showing the differences in dry gangrene, wet gangrene and gas gangrene. So let's start. Right. In dry gangrene, the limbs are most commonly affected. Wet gangrene, mainly the intestines is affected, and in gas gangrene also it mainly affects the limbs. The mechanism. In dry gangrene, it is basically because of arterial occlusion. However, wet gangrene is mainly because of blockage to the venous drainage. And gas gangrene is because of a bacteria, Clostridium perfringens. So, what will be the gross appearance in dry gangrene? In dry gangrene, the affected area will be dry, shrunken, and have a blackish appearance. In wet gangrene, the affected area will be moist, swollen, and have dark appearance. And in gas gangrene, the affected area will be pale, numb, shriveled, and crepitant. The line of demarcation is present in dry gangrene but not in wet gangrene or gas gangrene. Bacteria are few in dry gangrene, but in wet gangrene and gas gangrene, the bacteria is abundant. And putrefaction is limited in dry gangrene. However, because of lot of bacteria in wet gangrene, the putrefaction here is marked. And in gas gangrene, because there is infiltration of gases in the tissue, there will be marked putrefaction. So let me summarize this once again for you all. Gangrene is actually death of tissue because of lack of blood supply or because of bacterial infection. The gangrene is of three types: dry gangrene, wet gangrene and gas gangrene. The dry gangrene mainly affects the limb, the wet gangrene mainly affects the bowel wall, and the gas gangrene also affects mainly the limbs. In dry gangrene, there is a dry, shrunken and blackish appearance. In wet gangrene, the intestinal loops are moist, swollen and have a dark appearance. And in gas gangrene, there will be myonecrosis and it will have a pale, numb, shriveled, crepitant appearance. The line of demarcation is present in dry gangrene but is absent in wet gangrene and gas gangrene. There are few bacteria in dry gangrene. However, the bacteria are abundant in wet gangrene and gas gangrene. And the putrefaction is limited in dry gangrene but marked in wet gangrene and gas gangrene. So this was all about gangrene today. I hope you have understood the concept of gangrene and types of gangrene nicely. I will see you in my next video, which will be on acute inflammation. Please do subscribe to the channel, like and share it. Bye-bye for now.